Well, you've probably heard the word bipolar before. The term has become synonymous with the phrase mood swings, but not all mood swings are bipolar. Here to tell us the differences and reveal which celebrities may have this mental condition is Dr. Bradley Wajda with Esano Incorporated. Welcome back to the show, Doctor. It's good to have you here.
It's good to be here.
All right, bipolar disorder, so it's not mood swings, or it can be?
Well, usually people think of mood swings.
Okay.
And that's the reason it's so often misdiagnosed. Because when you see mood swings, you usually see them in people occurring rapidly throughout the day. Rapid mood swings are not bipolar. That can be several other conditions. It can be personality disorder, it can be substance abuse, it can be medical illness like thyroid problems. The kind of mood swings that you see with bipolar occur weeks, months, and rarely years apart.
There's such a stigma associated with bipolar disease, but then you look at some of these celebrities that it's pretty much well known they have bipolar disease and are being treated for it. You send us pictures, celebrities like Catherine Zeta-Jones, and I was surprised, Robert Downey Jr.
Yeah, it is surprising.
Jim Carrey?
Yeah.
Wow.
Well,
what can we learn from these celebrities?
Well, first of all, you can learn that you can function with bipolar illness. That's the important thing. You know, bipolar illness is, by definition, if untreated, something that will impair your ability to function. There's two types of bipolar, bipolar 1 and bipolar 2. Okay. Bipolar 1 is defined by having a manic episode. Okay. And that's something that would impair your functioning.
And because we were looking at those pictures of the celebrities, and a lot of them were comedians.
Yeah.
Does that have anything to do with it, you think?
Well, sure, because to be manic, you have an expansive mood, a very overly happy, elevated mood, occasionally irritated, but these are people that tend to talk fast.
Yeah.
They see themselves as very social, physically hyperactive, not needing much sleep.
Yeah.
They do view themselves as quite creative.
You say 2% of the population has bipolar disorder, and the typical age is around 20 years old, is that right?
That's true. And then there's another little spike around the age of 50 for bipolar type 1.
All right, and the rate of occurrences in families, it varies 4 to 24%. What does that mean exactly? Well,
that means that in a first-degree relative, like if mom or dad has bipolar type 1, okay, depending on the study you look at, you have a 4 to 24% chance of having bipolar type 1.
Got it.
If it's bipolar type 2, that actually drops down, but it's 1 to 5%.
When you say bipolar type 1 and 2, does that mean mania and hypomania?
Exactly.
Okay, what is that, and what are the differences of mania and hypomania?
Well, the main difference is they both have similar symptoms. Okay. Hypomania just is lesser intensity of symptoms, okay, so that you're not impaired. Mania is, again, impulsivity. That can be spending sprees or reckless sexual behavior. It can be sleeplessness.
So these are some of the characteristics of mania?
Absolutely.
Okay. That include racing thoughts, and you said sleeplessness as well?
Yeah. Grandiosity. Again, thinking you can do things you really can't. Getting involved in a lot of activities. You'll see people who will really just be involved in things that are not even reasonably completed in a short period of time. I mean, they'll take on all kinds of responsibilities and tasks.
And not get them done?
And not get them done.
Wow. Rapid pressured speech, motor agitation, and as you mentioned, a marked increase in goal-directed activity. How does major depression fit in with bipolar illness? Well,
it's not necessary to be present with bipolar type 1, although that's traditionally called manic depression. It is a necessary feature of bipolar type 2, so if you just have the hypomania, you do have to have an episode of major depression.
For at least 2 weeks?
For at least 2 weeks.
Okay, to qualify as a major depressive episode. And you know, the good thing about this is that, and this is the reason why you wanted to talk about it, is because it can be treated.
Absolutely.
Okay, so you want to take that stigma away from any mental disorder, really, especially bipolar. bipolarism. Is that how you say it?
Well, bipolar illness.
Bipolar illness. And how are people treated?
Well, primarily with medication. And that is, again, after you've ruled out all the other causes, because there are other things that can mimic bipolar. And true bipolar is often missed because you have to have mania for at least a week. You can't be manic this morning and depressed this afternoon and that be bipolar.
Okay.
And if you have 2 weeks of depression, you can see where people wouldn't connect those kinds of mood swings.
Yeah.
They would tend to connect the ones that occur just throughout the day.
So it's always good to talk to a doctor if you are experiencing any of these symptoms or know of anybody.
Oh, absolutely.
So go to esanohealth.com for more information, esanohealth.com. Where are you located, doctor?
We have an office at Big Garden Village. It's just to the west at 1100 West Shaw. And then we have an office in Merced at R and Olive Street.
Okay, so give the doctor a call, really, for more information, or if you have any questions, or just look them up on the website, esanohealth.com. Very interesting. It's good to talk to you, and I hope that you'll be coming back and educating us more on mental disorders.
Well, it is fun. I appreciate it.
Okay, good. Have a great weekend. Thank you for being here, Doctor. Appreciate it. Coming up on Central Valley today, we're talking to actress Rosario Dawson. Stay tuned.